I mean, you do. You have CHF, restrictive lung disease, obstructive lung disease, asthma, COPD. You have nephrotic conditions, acute kidney injury. You have brain tumors. You just keep going down the line. You say, well, I can actually do pretty much. I can conquer a lot in every organ system. If you change your thought process and say, okay, I'm going to knock out 60, 70% of every organ system, and then I'm going to cover micro, because I hope you guys understand micro is something that maybe many of you are familiar with. However, with micro, there's so many details that when you look at the breakdown on the USMLE.org website, talking about what's the percentage of organ systems they're going to test you on, if you get a question about endocarditis and they ask you about a micro bug, and they ask about a drug, so how do you label that? Is it under cardio? Is it under micro? Is it under pharm? That's the tricky part. So I never look at the breakdown because just being honest with you, whether it says 20% cardio, 10%, how does that help me? It doesn't help me at all. Because if they give me a condition like a respiratory condition, pneumonia, I need to know if it's walking pneumo, if it's typical versus atypical, if it's community acquired, if it's hospital acquired. Then I need to know most common organisms. Then I need to know, well, the organisms that we're talking about, what drugs are going to be used for those organisms. And then I need to know the MOAs of those drugs. And then I need to know the adverse effects of those drugs. You see what I'm saying? So if you're trying to pass the test in 60 days or less, by now you should have at least covered the QBank once, AMBOSS, UWorld, Kaplan. Focus on where you can get points like this. Think about ER and surgery, same thing. Patient walks in, okay, either we discharge them, we stabilize them right now, triage, or surgery because it's very, because obviously it's very, very serious. They're very unstable, right? Versus surgery, same thing. Internal medicine, family, we have time to think about things and we can cater to the person's needs and labs. I want results fast. I don't have time to teach you guys every little thing in physio and every little organ system. But it's a shame on all of us if we don't know the RIPES regimen, if we don't know certain drugs, certain bugs, certain everything. So if you want to pass in a short time frame, because this exam is not about knowing everything, it's knowing a couple of things really good, because we're spread so thin that it's like when you go to a magic show, it's like you have smoke and mirrors. Like, you need to know pharm, but you push it aside because you want to focus on physio and anatomy and other things and genetics and epi and biostats. I'm like, yeah, but do you guys know like the antibiotics? Not really. Do you know the HIV drugs? I kind of know the NRTIs, but I'm not familiar with them. It's like, wait, why don't you focus on that? Forget about the smoke and mirrors. Don't stretch yourself thin, because if you do, my friends, you will not get the points you deserve. Yes? All right. So, first aid's pretty good for me. I like it a lot. I know a lot of you guys have like index cards and flash cards. I want to provide some advice to that. And please, if you have any questions, you could ask away. I'm here. Here's a smiley face. Ask questions. Ask and I will answer, because I know a lot of you want to pass it. We all want to pass the test. Some of you here are on step 2 right now. Some of you here are taking comps for step 2. So welcome back. The step 1 exam is challenging, yes. Pharmacology, I would say flashcards.